with?
Kia ora, everyone. Thank you all for joining us today. For those of you who do not know me, I'm Alex Cobble-Chantren. I am Medtech's Integrations Program Manager. And today we have with us Cecilia Harris and Justin Begg from Echo-Health. And we will shortly have Rochelle Chapman from SR Referrals joining us. Both of those are partners of ours, which integrate with Medtech Evolution via our interoperability platform, Alex. Many of you may have heard of Alex before. It's not named after me, I promise. I'm sure there will be many questions and some great feedback coming up throughout the webinar. So as these crop up, please feel free to put those into the Q&A box down the bottom of your screen. You should see that come up. And the Echo-Health team will aim to get through as many of those as possible before the end of the session today. In the event your question is not answered directly in the webinar, we will ensure we will get contact and question details sent through to the Echo-Health team following the webinar to make sure that those are followed up. Also, for any who may have colleagues, associates, friends, whoever, who are really interested in attending today, but for any reason could not fit it into their schedules, we are indeed recording this session. So we are, of course, happy to pass this on to anyone interested. So without further ado, I will hand it off to Cecilia.
Thanks, Alex. Thank you, everyone, for joining today. We're very excited to talk to you about Echo-Health.ai. I believe a few of you will be familiar and will have attended the previous webinar, or I've spoken to you. I see that there's some familiar names in the attendees list there. But we'll start with what we're going to start today with just an overview of Echo-Health.ai. Then we're going to introduce you to Echo-Health.ai on the go. So what does it look like when we're on a mobile phone and how that integration looks back with Medtech? Then we're going to talk about Echo-Health.ai and SR Referrals, and I'm going to hand over to Rochelle to do a quick demonstration of how that looks, and then we'll just go to Q&A after all of that. So with that going on, what about us? What is it about us that is different? I know a lot of you will be aware of AI scribes out in the marketplace, but we're very focused on not just the notes, but what else we can do together. So we really focus in on making sure that all the patient clinician conversation is structured and coded. And what that means is that we can do more than just notes. And you'll see that as we go through the presentation today. So, we want to close the loop across care. So we want to, move beyond just the clinical notes, and you'll see that we've got a couple of things that we'll be introducing to you today, which is the integration with SR Referrals, being able to update observations, screenings within the system, and we're going to continually evolve our solution to really close the loop on all required actions. And we want to be clinician first, but also patient friendly and focused. So we'll talk about what we've got in that space as well. And it's this structured data which allows us to communicate not only with Medtech, but SR Referrals and other systems moving forward. So we sit within Medtech. We're embedded within Medtech, and we'll see that when we do a demonstration in a moment. We are an Alex app, so you open it up from within Medtech. Why is that so important? It is so important because it means that we have a secure solution. So when you open it up, the solution knows who you are, what facility it is, and what patient it is. So there's no more possibility of pasting notes into the wrong patient at all. We transcribe and we can have whatever notes format that you like. So we'll go through some examples today, but if you're sitting there and going, that's not really how I like it or how my doctors and clinicians like, you can create notes in a way that meets your requirements. So you're not locked into any format at all. But more importantly, once those notes are completed, it automatically updates into the daily record. So none of this having to copy paste, nothing about worrying about which patient it is, it'll automatically go through and update. If we talk about referrals, if we talk about multiple referrals, it'll identify that we've spoken about referrals and will give a reason to refer for each referral that has been identified, and that will update into SR Referrals. We can also update our screenings and observations back into Medtech as well. So in this case, a HbA1c updated back into the system. You can see it's updated into the screening history there. But we're also going to show you Echo-Health app. We're in beta. We're very excited. It's going to be launched out into the App Store very shortly. But it is exciting because what it means is that in certain use cases, urgent care, aged care, anywhere where you're not necessarily at your computer, you're going to be able to find the right patient and complete your consult with the ambient listening. And then that's going to update automatically back into Medtech as instantaneously. And then I'm going to stop sharing this screen and move on to another one. I'll put this one back up at the end where you can scan and we can offer a 14-day free trial and we can get you pricing, but I'll talk more about that at the end. So if we all just give me a moment where I swap my screen over and we'll go from there. Okay. Just need to work out how to get this screen up. Let me hit to, I tested one lot of sharing a screen, guys, but maybe didn't test the right one. Okay. I got this screen. Have you, and are you seeing, you're seeing all of it? Maybe if I move this one over there. Is everyone seeing my screen? Justin?
I can see it.
We're good. Okay. Now, Justin, you're going to come off mute and you're going to play patient for me again.
Okay.
We had some feedback from the last presentation that we did a very perfect demonstration where the patient was very compliant, did everything, and you know, we covered off all the details. Well, let me tell you, Justin and I have not rehearsed today at all, so it can go in any different way that is possible, but the purpose of what we're going to do is try and show you how some of the how some of the features work within the system there. And you can see I opened up the system and it logged me in automatically into Echo-Health. It knows when we open it up who we are and it logs in and does all of that for you. You do need to open Echo-Health for every new patient. If you don't open it for every new patient, there's no way for the system to know who that patient is. So it's a few seconds, but it offers that huge level of security within there. If we hit plus, and we'll grab our patient from within the system here, and we can update the patient details. And we can also grab patient history from within the system. So we can grab the patient context and that can be included as part of the consult. We'll do that today. And then we can hit start listening. And we can say, Justin, thanks for coming in today. Why are we here?
I've been a bit tired, more tired than normal, and I've actually lost my appetite as well. I'm not sure what that's about.
Okay. Thanks, Justin, for bringing up a disease state that I'm not overly familiar with. So let's talk through that. Would you? Let's just think. You're tired. Okay, so maybe we should run some blood tests. So we'll run
blood tests would be good. Yeah.
Run a panel of blood tests, and we'll check all your normal levels. And let's actually go back over your history. And I think you suffer from type 2 diabetes.
Yeah, I've had that. I have had a diabetes for quite a while, but I've seemed to be managing okay. But it's probably a good time to review that.
Okay, so we'll have a look at that. And you're actually, your last blood test of your HbA1c was 7.3, so it's actually a bit high. And you've been on metformin for quite a while, and it doesn't look like your glycemic index is under control. So what we might do is we might refer you off to an endocrinologist. And they can have a look at that. How's your diet going?
Yeah, I'm sort of having breakfast pretty regularly, skip lunch often, and then have a big meal in the evening. Probably could eat more vegetables and fruit potentially as well.
Okay. And are you having sweets and sugar, carbohydrates in the evening?
Every day.
Every day. Okay. We could also send you off to a dietitian that perhaps can help you with, managing that diet. So, really thinking about how to cut down your carbohydrates and keep that better under control. So we'll send you off for the blood test again to check on your tiredness levels. And then we will also, do the 2 referrals off to the dietitian and the endocrinologist. And if you can also focus on doing some more exercise.
Yeah, I can do that. Any suggestions?
Maybe a brisk walk for 20 to 40 minutes every second day.
Okay, I can do that.
Excellent. Excellent. All right. Well, I think we're going to stop listening now because that is an absolutely atrocious example of a consult for all the clinicians in the room. Yes, you do not want to come to come to see me if you've got increased tiredness and fatigue, because I've got no idea. But what you can see there is that we've instantly created our notes in the format that we've got defined. So our format is over here, and it can be in whatever format, whatever you would prefer within there. And we've got all the information. All of this can be reviewed and updated at any point in time. And then we can click Update Notes, and that is going to write directly back to the daily record for Medtech here. And at the same time, what we've also done is we've identified the observations that we talked about. So our screening observations in here. And we've written that back. And we've also identified that we've spoken about different referrals. So in the case of the endocrinology and the dietitian, and that will write back as well to Medtech, and then that will be picked up into SR Referrals in here. So moving forward, there's a few other options that are available here. Before we jump off, we'll move to the patient screen, whereby we're actually identifying what is the patient insight, the patient literacy, and the justification of why the system has determined the health literacy, the sentiment, the emotion, and the confidence of which that has been defined. The health literacy is important because we also then write a summary that can be SMSed to the patient, a to-do list that can be SMSed to the patient. And we take into account the health literacy of the patient before determining how to write that summary and to-do list. So generally, it's written in a far more basic, far more patient-friendly language than is typical for a medical environment, because it's about making the patients understand what they've been told. And these can be then sent an SMS to the patient. And I'll give you an example when we move on to the mobile phone within there. We also identify what disease state that we indicatively are talking about. So we're not determining the disease state. We're looking at and going, this is likely diabetes. And from there, we've linked into the Health.ai database. And we can then send on the patient information from Health.ai about type 2 diabetes. So we have a relationship with Health.ai, which allows us to bring in about 350 odd links to various diseases where they've got relevant information on their website. We also have the ability to do templates within the system if there's something relevant. So this can also update into the inbox and also right back to the inbox in Medtech within there. So we have a number of different things available within here. And we also have the ability to do additional dictation post the consult. So that might be, you know, an example of you've done a biopsy and you want to write a lot more detailed information than was relevant to potentially read out to the patient. So you can put that information in there and then rerun your notes if required. It's worth noting that one of the challenges when you're moving to ambient speech to text is the need to verbalize all your thought processes and why you're doing what you're doing. Because if you don't speak it, it won't come through. The feedback that we've had is that patients really like it when clinicians verbalize what they're doing, because it gives them a better sense of what's going on. So it can be a win for yourselves in regard to getting those detailed clinical notes, but it could also be a win for the patient that gets a better understanding of what is actually going on. So that's an overview of Medtech and the integration within the desktop version. And I don't want to spend too long on this because this is a lot of what we covered off in the last webinar. So what I'd like to do now, if okay, is I'd like to show you what it looks like on a mobile phone. That's all good. And once again, I need to stop sharing and reshare. So just give me a few minutes, a few seconds, sorry, to do all of that. Okay. Can we all see my screen? Can I get a thumbs up from the, yay, amazing. Right. So one of the feedback that we had was, you know, microphones being close to computers. How does that work potentially in an urgent care environment? How does that work within going out into the community? What can we do in that space? So what we have done is we've created an app, but the app is one that is fully integrated into Medtech. So the difference between this and when you're using it on the within Medtech is that you now have to put in some information to find the patient, because we're not opening it up automatically from within Medtech, from within the patient record. We need to find the patient. So we can find the patient in two different ways. We can either find them by their NHI number or by their date of birth, family name, and phone number. So I'm just going to put in my patient that I know's NHI number. And we've found Sally Brown here. So Sally Brown that's been directly found from within Medtech. You can see that file number. I might just take a little moment while we've got this to talk about the safety that we have with regard to patient information. Although you can see that we've got Sally's name up on the screen there, we're only holding that in a temporary state, and that has come completely from Medtech. At no point are we holding any patient identifiable information on our system. That big long file number, that's the key. That's the way that we as Echo-Health and Medtech can talk to each other. But because we have that key, we don't need to hold anything like the NHI number, like the name, in our system at all. At this point, it's just being represented on the device. And once we move on, it will be removed as well. So we're going to hit record on the phone, and we did test this earlier. So Justin, you can come off mute. I'll just put my phone up a little bit further. And you can see that we're actually running live transcription in this case on the phone. We don't do that in the web version just because there's a potential in the web in the embedded version to potentially lose words. But in the mobile device, we can do live streaming of the transcription. So you can see it all coming out as we speak. So, Justin, why are you here today?
I'm tired. I've lost my appetite and I'm not managing my diabetes properly.
Okay, excellent, excellent. So let's continue on with a very poor GP consult here. And what we're going to do is, Justin, I think for your tiredness and your loss of appetite, potentially we're going to send you off for some blood tests first. So we'll check the blood test. So if you could go next week for your blood test, that would be really good.
Okay.
And I believe you have been on metformin for a while.
Yeah, quite a few years.
Quite a few years, but we're still having some trouble controlling your glycemic index and your HbA1c.
Yes.
Yes. So how are you going with your diet?
Yeah, I have a pretty big breakfast most mornings. Skip lunch, grab a few snacks occasionally. Dinner I get takeaway too many times probably. Have a proper meal maybe 3-4 times a week. And I've got a bit of a sweet tooth, so I am eating, having dessert most nights, and a couple of, sitting in front of the telly watching football, eating chips as well. So not great.
Okay, so maybe we'll send you off to the dietitian for to maybe help you manage your diet there. You've been on a first-line metformin medication for, as you said, many years. That's not necessarily giving us the control on your HbA1c. That last one came back at 7.3. And so what we'll do is we will get you to review an endocrinologist. So if you can, if we send you off to the endocrinologist can review your medications. They may consider putting you on either an SGLT2 or a GLP-1, or potentially look at insulin if they think that that is the best for you. But they will do that full review within there. How's your exercise going?
Probably should do a little bit more. Occasionally walk the dogs, but not often enough, really.
Okay. So once again, do you think you could do a brisk walk for 20 to 40 minutes every second day?
Yeah, I think I can fit that in.
Okay, excellent. So we're going to get you those referrals and we'll go from there.
Okay, thank you. Sounds good.
Amazing. Right, so we're just going to stop, hit our button. We can see all our documentation coming through, our transcript coming through there, and then we can process the information. So once again, the same information, the same format within there, and we can see all the information that's come through there, and we can hit update note. And you can see that that's now said update notes into the daily record. Once again, it's also identified that we've got the referrals there. And so we can click on these and these will update back into our system and be picked up by SR Referrals. We can also pick up the observations, so the HbA1c that we discussed, that can be in there and written back. So you can see all of these things that we discussed, they're on the phone and they're written directly back to Medtech. We can also get that patient information that we talked about earlier. We can send off the summary. We can send off the to-do list. We can send off the diabetes information within there. And we can hit send SMS within there. Once again, all of this can be reviewed and updated. Anything that needs to be changed. And that can go in there. I will just see with my phone. And there is the SMS gone through to the patient then and there. So you can see you've got all of that information directly from within the phone there as well. We also have the ability to send SMS reminders to the patient as well. So we can do all of that within there. And so all of a sudden we're up to date and we've got everything on the phone, and then that is passed completely back into Medtech. And before I hand over to Rochelle, what I'm going to do is I'm just going to stop my screen there, and I'm going to go back over here, and I'm going to, jumping from thing to thing at the moment, everyone. So thanks for your understanding for the second as I get up the right screen. And you can see that that has just been updated directly into the system there. And if we go to the screenings, that HbA1c has just gone in straight from the system there. So you can see that direct integration from the phone all the way into Medtech. So there is, for the GPs and the nurses that are in the rooms, the phone's not going to be the solution, but where urgent care or out in the community, there's an option available for you to do that. So on that note, I'm going to stop sharing and I'm going to hand over to Rochelle, if that's okay.
Hello, everyone. I hope you're having a good day today. I am just going to bring my screen up, 2 seconds. Can everyone see that okay? Great. So what I've done is a pre-prepared little lesson, a consultation. The patient has come in with a couple of swollen fingers. They had a bit of an accident when they got tackled funny at soccer. This is actually my daughter a few weeks ago. So this is just again a poor GP consult because it was done by me. From this point, what we'd do is you'd come in and you'd click the referral button. You'd see that I've kind of suggested 2 types of referrals, and then we sort of click on, we're going to send those both through. What that does is that creates a unique key that talks between Echo and Medtech. And what we do is when we go into the referral, which I'll take you through to a second, is we use that unique key to then pull that information back. We'll just close out that. Close. In the patient, so as normal, and I'm sure most of you know, SR, you'd come in and you'd start a new referral for that patient. You'd go through and you'd select and search for whoever you're doing your referral for. That would bring up your normal referral form. You'd go through and select if there's a radiology, potentially trauma or injury, for example. If they've got an ACC claim, you go through and select that to bring through what we want to add in terms of what the Echo has created in terms of a referral reason. You click on the view consultation notes. You'll see here this Echo key. This is the key that I was talking about before. Again, it's unique for each consultation. So you'll see different consultations here that we've been playing with, bringing those keys through. So you might have multiple referrals there that are coming through. So in this instance, we've got a referral for physiotherapy as well as radiology. So I'm going to click on the radiology one. What it does is it brings through the information that has been created back through. So that saves you from sort of having to type that all in. You can still also add, if you want to, the full consultation notes if that was applicable. But this just means that it allows you to have that really succinct consultation referral for reason, rather than having to have the full consultation note come through. You then complete the form, the SR form, as you normally would, and submit it, and then that would go through in the normal process. It's that simple. All right, that's us.
Excellent. So we've bombarded you with a huge amount of information, lots of demos, lots of atrociously demonstrated consults. I'm just going to put back up my screen, which has the QR code on it, and that will just allow you to fill in a form if you would like more information. Just let me get that up. We'll do that. So let's just talk about a couple of things before I jump into the Q&A. The Find Out More will allow you to have a 14-day free trial and also get clinic pricing. What does pricing look like? It is unique for each individual clinic because we do FTE pricing, and we also do a discount on the amount of users. So if you'd like a detailed pricing, please fill in the form and we will get that back to you. The reason we do FTE pricing is because we feel that that's the best solution for organisations. Particularly, there are certain cases, urgent care would be a good example, whereby you might actually have 40 or 50 clinicians that work for you, but the equivalent would be 12 to 14 FTEs. We don't think it meets the commercial model to purchase for 40 or 50 clinicians that may or may not use it every week. So we really do focus in on that FTE model. But what it would mean is that we would load up all of those 40 or 50 users within the system, and then we track by fair usage on what's been agreed associated with that. So we feel that gives people the best it should meet the best commercial need for organisations. So if you fill in that form, we'll be happy to get pricing back for you. We're also happy to do a 14-day free trial within there, and I'll send you off a form that will allow you to get that going. It is worth noting, to do the 14-day free trial, there is a reasonable amount of work that needs to go into getting it set up. So we need to contact Medtech. The Alex app needs to be activated. We need to set up each user to meet to allow Medtech and Echo to talk, and make sure that we've also configured it to meet your needs. So very happy for you guys to do the 14-day free trial, but very keen to make sure that we've met your needs and answered all your questions before potentially going down where you have to invest some time, and so do we in that process. So feel free to fill that in. And I think now I might jump to some of the questions, Alex, if that's okay.
That is a brilliant idea. I think we've got a few. And so I think Tim, I did notice, never apologize for question spam. That's what we're here for, is those questions. So I did like that comment, but please never apologize for having questions. It's always great to be popping those through as you come up with them in the webinar too, so we don't miss anything. Okay, so we can start with the top one there. Can you integrate with BPAC or any other systems for Te Whatuora / Health New Zealand referrals, as this is more of our workload than SR?
So we're very keen on integrating into people's workflow, not workload, and seeing what we can do to meet those requirements. We have just started with SR Referrals, and Rochelle and the team have been a great partner with that, but we are very keen to make sure we're part of your workflow and are happy to talk to other partners moving forward. So it's kind of just a stepping process that we're going through with that.
Okay. And are you working on a solution to auto-update Echo-Health for when you open a new patient? Say for those on the appointment template only, having to manually do this for every patient will be an issue.
So that is an interesting one, and I think that might come down to a bit more of a Medtech and an Echo solution. One thing that I am looking at on the mobile device is, can we pick up the latest patient from an appointment to do that? So we're definitely keen to make it as easy as possible. But we're probably, some of this is just going to be a little bit working together, and certainly we have a really good relationship with Medtech and the team, and very keen to make this as smooth as possible. I do want to caveat though, there is always going to be a few second delay when you've got to make sure you've got the right patient. And it is important that we have that, because we want to make sure that the systems are talking to each other correctly.
Okay. So the next one, are you looking at integrating with lab ordering systems as well for auto ordering blood and urine tests?
It's probably a little bit further down the product roadmap than a couple of the others, but we are very much focused on, if you say it, can we action it? So it is very much on the roadmap, but I think there was a question on medications in there as well. The medications one is probably further up the product roadmap, and when I say medications further up the product roadmap, I would expect that potentially in Q1 of next year. So as in, if you speak it, it will find and validate the medication, and then you will have to check that you've got all the right information. Everything, there will be nothing that gets done automatically. It always will have to be clinician approved.
Okay, and next, are you looking at writing classifications? And then there's a question for the Medtech team, so I'll quickly jump on that before handing it over. Medtech, are you looking at mapping to SNOMED shortly? So I won't speak entirely on behalf of the product team, so I'm in integrations, but I do know that it is part of their roadmap, and they are undertaking a very comprehensive review of their clinical stuff at the moment. So there are quite a few changes that they're looking at, and so I do know it's part of that piece of work.
And I might jump in and add to that. We are mapped to SNOMED, so we don't do every single possible classification screening that can be written back. We are limited to I think about 15 to 18, I can't remember off the top of the head, that are all currently mapped to SNOMED, because we actually can't update back into the system without SNOMED. So any of the ones that we do are already classified to SNOMED.
Okay. Hi, has this tool been approved by Health New Zealand's EAG?
So we're in the process of having that conversation. We're undertaking that process, and once again, I would expect that to be completed by the end of, I'm hopeful by the end of this calendar year. But we're starting conversations with them directly.
How modifiable is the referral letter template for SR referrals? That one is one for Rochelle.
Sorry. We've got different templates based on the type of referral that it is. The content itself, where you saw that the referral information comes through, there's two places that you can make that change. You could actually make that change in the pop-up that happens in Echo-Health. So it'll come through and give you the description there. So you could actually change it at that point so it gets pushed back into the system, and then we just pick it up into the referral form. And then, or you could actually pull it through and then make any additional adjustments. That whole field is a WYSIWYG field. Yeah. Does that answer the question?
And to add further to that, it will pull out different information depending on the type of referral. So radiology, it will get the location, etc. Other endocrinology, it will look for medications and what's been done. So within what we're looking at within there, it can be updated and adapted as required.
Okay, and then how is clinical accuracy measured and assessed?
So we have a clinical framework that we work towards. We have a chief medical officer that is involved in that. Tim is also an active GP, so unfortunately he was already booked up today. So we do review regularly the accuracy of what comes through. We are acutely aware of potential weaknesses within there, and there's some weaknesses around very, very, very short consults. So it should identify some issues if you try and make it really, really short, as in 5 or 10 seconds. But we have a very strong framework around making sure it's only pulling out what is discussed in the consult. And then within things like medications, there's a whole lot of normalization that goes through to map that. And then we put confidence scores against everything that we do. So we can then go back and review very easily the things that are coming out low confidence and see whether we need to tweak anything within that. But we're also reliant on feedback. So where something comes out inaccurate, we do require people to let us know so we can see what we can do.
Okay, the next one might be more for me. Joel wanting to check if there are any upcoming plans or changes regarding inbox management in MedTech. Now, very aware this is a very hot button topic and quite a pain point for clinicians. So very much appreciate that. We are in early conversations with several folks around inbox management, but it is early stages at this point. So the inbox is naturally something we want to be very, very careful with. And so what that looks like we're not sure quite yet how that management will look. But if you do have any ideas or anybody you would like us to have a conversation with, I will be putting up an email address at the end of this webinar session. So you can please feel free anytime to get in touch with me directly through that email address to make any suggestions that you want to see in integrations or propose anybody you wish for us to have some conversations to potentially partner with. And the next one, when will AI assistants be available helping with provider inbox management? So that somewhat relates to,
yeah,
to that,
and
but
we're actively aware of what needs to happen there, and certainly we are, we are looking at this, and we are talking with Medtech about this as well. It's about how to do it in the most clinically safe way possible. I think you will hear some movement on that soon because it is something that goes to Medtech. It's something that comes to us quite regularly. So I put this down on watch this space, and we'll come back to you.
Yeah. And this is why these webinars and just general feedback from everybody here who's in attendance, this is why this is so valuable to us, because that's how we shape this health ecosystem, this partner ecosystem, to make sure that it's working for you and not the other way around. So obviously inbox management is quite a complex issue, and we do want to make sure that when we do it, it's done correctly. So absolutely, it is a watch this space, and it'll be a very exciting thing to leap off come the time. From Tim, that would be ideal if we could modify a prompt template for the AI for SR referrals rather than manually writing over what Echo produces.
We can, that is something that can be implemented. So I guess we describe this as we're at version 1, but it's configured to allow for that, so we can get that on board. But version 1, we do our learnings, and then we move through to what's required for a version 2. But we're configured to allow for a prompt template on that.
Okay. Does anybody else have any other questions? I'll also just leave it in mind that I don't know if anybody else like me is on the call where you wake up in the middle of the night and that's when all the questions are burning in your brain, not when you're put on the spot to come up with questions. So if you do have anything that comes up, please, of course, never hesitate to get in touch with Cecilia, with us here at Medtech. We're always happy to help however we can. And we've got another one. Can you email or use patient prompt for sending the patient summary rather than SMS? Good question.
Tim, the issue, so the patient, I can see the next question, patient portal. We've had conversations with Manage My Health and looking to see what we can do in that. The problem with email is it's actually not secure. So there's just some issues that we have in and around email. Happy to work through it with people on that, because at the end of the day, if anyone gives their work email, that can be accessed by any system administrator. So we're a little bit concerned on the email. From a system perspective, it can be achieved. It's just always about what's the best secure way to do that. We can also look at secure messaging, but sometimes all of this can be a little bit overkill. So we've just got to work through what's the best solution. The other alternative is that we can create a PDF that can be potentially created and sent through.
Okay. All right, I might pinch the screen if that's okay. Cecilia,
Yes.
see if I can.
Stop that.
Here we go. If we, oh, there we go. Oh, if it would let me, that would be fantastic. There we go. So I've just popped that up. Hopefully folks can see that. So I've gone ahead and popped up just up there. We've got this email address here, activatealex@medtechglobal.com. I know it's always a bit of a, you see a shared email address. I promised you we're checking this very regularly. It comes directly to my phone. So you might get an answer in the middle of the night if I'm having some trouble sleeping. But anytime you have any feedback whatsoever, or there are partners or any kind of functionality that you really want to see Medtech working with, please let us know. This is seriously valuable feedback that you're providing us. So it's extremely helpful. And so please reach out anytime that anything comes up. If you do wish to scan our QR code here, this does take you to our partners page. So this shows you Echo-Health, SR, and any other partners you may wish to have a look at. Do we have any other questions just before we tucker off? If there are any other questions. Now, Cecilia, I might leave that to you to have a look at the Q&A if that's all right, just because I've got my screen shared up.
I think we've just got cool thanks from Tim. So I think we're right to go. So
fantastic.
Thank you everyone for joining us.
Really appreciate everybody taking the time today. As mentioned, if you wish to have a recording, this recording passed on to you directly, please feel free to contact us at that Activate Alex email address. Otherwise, thank you so much for taking the time out of your very busy schedules to come and see what we've got on offer today, and of course for providing your questions, your feedback, all of that. This is pure gold to us here, so it's really great to see the involvement. So thank you so much, and have a great rest of your day.
Thanks a lot.
Thank you all.